The Kendrick traction device, or KTD, is a compact traction splint for lower extremity injuries, such as a midshaft femur fracture. The KTD is often the go-to traction device in remote and austere environments, as it is compact, lightweight, and can be applied by a single rescuer. The device can be used on adults and pediatric patients. The KTD contains a folding snap-out aluminum pole, elastic, color-coded leg straps, an ankle hitch, and an adjustable groin strap. Apply the ankle hitch slightly above the ankle bone. Tighten the stirrup by pulling the green tabbed strap until snug under the heel. Apply the groin strap by sliding the male buckle under the leg at the knee and seesawing upward into position and buckle. Place the traction pole alongside the leg so that one section of tubing extends beyond the bottom of the foot. This length would equal about 8 inches or 20 centimeters. Insert the pole into the traction pole receptacle. Secure the strap around the knee. Connect the yellow tab of the ankle hitch to the traction pole. Apply traction by pulling the red tab. Patient comfort will be your primary objective and will guide how much traction you apply. Finish packaging and applying the upper and lower leg straps. Be sure to reassess circulation, sensation, and motion after traction application and throughout your care.